Hi there. Today we are talking about type 2 diabetes. As far as I'm concerned, this is one of the most poorly managed conditions that we have. And that is why it is near and dear to my heart. And I want to bring it to fruition today and have a little video on it, okay? So if you're having blood sugars that are out of control and you go to the doctor, what happens? You're like, here's a prescription. Come back and see me in 6 weeks and we'll look at it again, right? Friends, that is not acceptable. It is not acceptable. We can do something about type 2 diabetes. You can reverse it. And if somebody tells you differently, you better go get a second opinion. Okay? Look, we have an exact protocol for type 2 diabetes. Okay? We have a roadmap that we can help you. It's been used in over 3,000 patients. We've been using the same system for the last 17 years, and it works. If you follow the roadmap, it works, okay? We do testing. We don't guess. We have testing. We test for toxicities. We test for inflammation. We test foods, and we find the root cause, right? And we go there at the cellular level, and we come up with a plan to show you how to get better, all right? There's an integrative approach here, okay? But we definitely have an issue with type 2 diabetes that we need to get control of. Here's the thing. There's over 70 different hidden sugars out there. So when you're grocery shopping, are you even knowing that you're eating these sugars? You don't even know what the names are. And was that done by design? Like high fructose corn syrup, right? That is so addictive and you only need a little bit because it's so sweet. So why are we using it when it's not healthy for us? And it wreaks havoc on our liver, okay? There's other things like tapioca. Tapioca spikes your sugars higher than regular sugar. So there's a lot of hidden sugars out there. And you need to know them so you can choose whether you actually want to put that in your body, right? You just need to keep track of it because they keep changing the name of the stuff. So, you just need to know what you've got in your labels, right? And we help you with that. So, like I said, type 2 diabetes is absolutely reversible and we can stop it in its track, okay? But I just want you to know that the CDC guideline, I was researching this for this video, there's over 130 million people with either prediabetes or diabetes. That is unbelievable. I didn't even compare it to other countries to see where we stand, but I guarantee you we wouldn't fare well. Like, we are having insulin resistance. Why is that? I know that our pancreas produces insulin. I know that we need sugar for energy and that our cells have to uptake that sugar and give us energy. And I know that our bodies are made of cells. Our cells create our tissues, which create our organs. So we need to look at things a little deep, and in just a little bit, we're going to get into the woods, sciencey a little bit, and to kind of show you what I'm talking about. But the thing with diabetes is that you have insulin resistance. Why? Because your cells are inflamed, okay? And if you even knew the amount of money that is being made and spent in our country on diabetes alone, do you know that when my son had diabetes, he had late onset diabetes, type 1, and I watched him for 2 years in a row go into the ICU, intensive care unit, with ketoacidosis. He had this fruity breath smell, and he was very, very sick, and he was on an insulin drip, and he couldn't eat until the anion gap closed, and it's devastating, right? And then to be discharged from the hospital with this prescription, and I went to the store and it was over $800 for his insulin. $800. He did not have insurance at the time. There was nobody saying, hey, we'll help you, right? It was like, how in the world can people afford that? Like, I don't even understand $800 for insulin. So it has definitely been a passion of mine to bring awareness to this, to make change. He's doing well now, guys. He's killing life and doing great things, right? because he has a roadmap and he decided he's, going to do the things he needs to do to take his health back. And he is killing life. And I'm super proud of him. But I want to show you guys the roadmap so you can do the same thing. Okay. But here's the thing. I want you to look up the statistic. If you can see the CDC guidelines, 130 million people. That's 1 in 3 people in the United States that are either pre-diabetic or have diabetes. And if you see the devastation that I see being in the healthcare for over a decade, watching people lose their limbs, watching people lose their life, watching people on dialysis. I was a clinical nurse practitioner for a while and drove around all these dialysis centers, and I still see these dialysis people coming to the hospital all of the time. And it's just like, I can't even believe some of the labs that I'm seeing, like the devastation that diabetes causes when we can prevent it. It's unbelievable, guys. Unbelievable. It wreaks havoc on everything. It destroys everything. So you don't have to be a statistic. I don't want you to be a statistic, okay? So we have big plans for you, all right? All you have to do is be motivated, show up, and ready for change. That's it, right? Don't be a statistic, okay? You do not want to go down this road. It is painful. I've seen people have neuropathy. They can't feel their feet. They step on something and they get an infection. They have gangrene. They're losing their limbs. They don't even know. It's like, can you smell the foul odor? You can't even feel your feet, right? You lose your ability to drive because you can't feel the foot pedal for gas. You can't feel the brakes. What about the ability to walk because you can't feel your feet? What about the neuropathy pain? And then they put you on some other medication. So it's one medication after another medication after another medication. Let me show you here. Let me show you what we're going to talk about here, about why this happens on a cellular level. But first, who am I and why should you care? I am a board certified nurse practitioner. I have several certifications, one in Ayurvedic medicine, which is ancient medicine. And I use that a lot as an integrative approach because I like to do least invasive to most invasive approach to my patient's care. I use essential oils. I'm certified in that as well. We make tinctures and help people there to support different ailments. I am neurolinguistic certified and I help people with mind behavior. And we know that we have to treat the whole body, right? Because you are a mind, body, and spirit. So we have to treat all of it. And so that is why I got that certification and trained and worked so hard and was trained by one of the best in the country. He came all the way from Hawaii. He was actually outside of our country. So that was awesome to get that certification. I have 4 college degrees and I'm a learner every day. Every day I'm showing up. It doesn't matter. There's 24 hours in a day. This girl's in the books. This girl's learning something to do better tomorrow than I've done today. That's what I do. So I'm a forever learner. I collaborate with people. I do speaking engagements. I teach other providers how to do what I'm doing. And I help patients as well. So it is a full circle approach, because we all need to stand together and rise up and help. And so this is my part by helping you today. Okay, but that is enough about me. We're not here to talk about me. We're here to talk about you and your health and wellness when it comes to diabetes type 2. Okay, so let's go here and talk about the cells. Here's the issue with the cells, and I'm just going to go in a nutshell. Grab a pen. This is a healthy cell. And then there's waste that comes out of the cell, and there's oxygen and nutrients that go inside a cell. Our cells are semi-permeable, right? The bacteria and stuff live on the outside of the cell. The viruses live on the inside of the cell. And it's supposed to be able to have things go in and out of the cell. But when you have these little fibers here, these little hair-like projectors, okay, these are receptor sites. This is how our cells communicate. This is how our hormones communicate. And diabetes is definitely a hormone, and it's a hormone dysfunction, and that's how we get diabetes. So the cells can't communicate. This right here, this is a dysfunctional cell. The cell is working, but it's not working properly. I mean, do we actually know that it's actually working? But it's not working properly because it's dysfunction, right? It's got these broken receptor sites. Yeah, there's supposed to be a circle here. But guess what? The cell is inflamed. That's what this redness is about. The cell is inflamed. So it's not working right. It can't hear, right? Imagine like being deaf. You can't hear. So you can yell at a person all you want. They can't hear you. And that's the same thing with a diseased and dysfunction cell. This cell is a disease cell. This cell has missing, broken receptors, right? And so it is really damaged and diseased. So we want this dysfunctional cell. We'd say this is the diabetes or pre-diabetes. Pre-diabetes. And then this is the diabetes. So, okay. What we do is we do a metabolic reset, right? We get things back down on a cellular level. We do the tests because we know the tests don't lie. We look at the toxins, we look at the foods, we look at the inflammation markers, we look at all of these different things, nutrient deficits, you know, what's happening in your body right now, and we attack that and we give you a game plan, okay? And what we're doing is we're getting these healthy cells. We want all of your cells to be healthy. So we want to repair the dysfunctional cell. We want to repair the disease cell. If we cannot repair these, our body will try, then it does something called macrophaging, which is your white blood cells. They go out like Pac-Man and they get rid of the disease cell and the dysfunctional cell if it cannot be repaired and restored. Okay, our body is made of billions of cells. So what is cancer? Cancer is an abnormal cell, isn't it? Right? So don't you want to get rid of any disease cells that aren't in there doing your body good, but just doing harm? So that is what we do. That is the point, is you want your cells to be healthy, not dysfunction. This is the pre-dysfunction. This is like alarm. I have a lot of sugar, and we don't pay attention to it. We don't do the necessary things to go back to the healthy state, right? Then what's the next action? Our body just can't, it's going to keep trying because it loves to stay in balance. It loves homeostasis, but it can only do so much. You are the driver of your body. You are what you put in it. You are what you put on it. You are what you rest. If you're not resting, you're not sleeping, your body's not healing, because we heal when we sleep. So there's a lot of components to this, guys, but if you don't fix this pre-dysfunction state, you're going to get to the disease state. All right. And that is some of the stuff that we talked about that I've seen, and it is absolutely devastating. So I like to hear hear your testimonies at the end of it. You know, I like to hear the success stories. I don't so much like, you know, watching the side effects of diabetes type 2. It's no fun. So here's what I want you to do. If you are interested, you can click on the link below or around or up top to the side. I'm not sure where it is, but I'm willing to have a 20-minute discovery call with you. You just get on my schedule and look at a time that's convenient for you, and we'll have a talk. I'll ask you questions. You can ask me questions to see if this is a right fit for you. Because let me tell you, we run a very busy practice. We help people not only with the prediabetes and diabetes type 2, we help people with their gut health. We help people with weight loss and thyroid dysfunction, ADHD, breast implant illness, detoxification. So we're very busy. So if you can't do two things, these are our two rules. If I'm going to carve out 20 minutes for you, I want you to carve out the same 20 minutes for me. And the second is be motivated for change. This is not a get a pill and get fixed, right? This is take action and be ready for change, right? This is not a quick fix approach, because that never works. And that's not what I am here for. And that's not what I can offer you. So if you're serious about change, you're ready for change, and you want help, I am absolutely here to help you. All right. I've got the roadmap, I've got the blueprint, and I can guide you through everything. So if you're ready for change, click on the link and I'll see you on a discovery call so we can get to know each other and I can answer your questions. All right. Well, thank you for watching my video and I hope to talk to you soon.